welcome to the podcast. Today we're going to be talking about autoimmune clues that fly under the radar, a functional medicine approach to living with autoimmune diseases. And we're going to be covering kind of a general full scope. I'm very excited to be joined by one of our lead functional medicine providers here at Matrix, Colin Renaud. And Colin's going to break down everything we need to know about autoimmune and living with, dealing with it, the lifestyle of it. So the way that the episode is going to work, per usual, is we're going to go through our discussion. If you have any questions, then feel free to leave them in the comments, and we will return back to them for our live Q&A session. And then we might be covering case study if one comes up. We'll try. Yeah. And then we'll return to those questions for that session. So just a reminder that before we get started, that these episodes of Med Matrix Method podcast is always for educational purposes only. It should not be meant to be personal medical advice and should not replace care from your own medical provider. Autoimmune symptoms and autoimmune diseases should be evaluated by a qualified healthcare professional. And if you are interested in receiving personalized medical guidance from one of our providers, like Colin, then we would be happy to help. You can go to our website, book a discovery call, and start the process of becoming a patient there. So, Colin, why don't you give us an introduction? Let's get started.
Yeah. Hi. Like you said, I'm Colin Renaud. I'm one of the lead clinicians here at Med Matrix. I have a pretty unique background. I hold multiple board certifications in natural medicine and anti-aging, in functional medicine. I'm fellowship trained in anti-aging and functional medicine. I've been a functional medicine provider for a little over 10 years now. I specialize in anything from hormone replacement to weight loss to nutrition to gut health to peptides, all the in between. So yeah, I'm excited to talk about this. I do get a lot of autoimmune, not a lot, but a handful of autoimmune cases at a time, and they can be tough. Autoimmune conditions, in my opinion, are undervalued a lot of times with some of the patients we see, where there's a constitution and constellation of symptoms across all different body systems, and patients are seeing all different specialists for each individual symptom, and they're not really getting anywhere. So this is, I think, a really great topic to cover. And like you said, I think we should do some of the specifics on these things. I think it'd be helpful.
All right, so let's get started with what is an autoimmune disease? When we say autoimmune, what is actually happening?
Sure. I think that's a great place to start. So an autoimmune disease basically is when the immune system, which your immune system is what functions to keep your body safe from invaders and sickness and illness. The autoimmune process really happens when your immune system mistakenly targets the body's own tissues. Depending on the condition, the immune system could target your joints, your skin, your thyroid, your nervous system, blood vessels, certain muscles, glands, and also multiple body systems at one time. So one of the most common autoimmune condition that people probably think of is autoimmune hypothyroidism, or hashimotos, where the body is essentially attacking the thyroid tissue. So there are, as you mentioned before, multiple different autoimmune diseases that present in multiple different ways. But I think it's important, which we'll cover a good bit of, is sort of where this all comes from. Is essentially, is it genetic? Is it environmental? Is it both? Is it diet? So I think that'll be a great place to dive into a little bit later.
Awesome. So what are some of the autoimmune clues that people usually explain away? By explain, we mean like excuse,
Yeah. Some of the most common autoimmune clues that are under-recognized or people kind of explain away are some of the more broad symptoms that people have that could be classified under other things. So like fatigue, right? Fatigue could be anything, could be a lot of different random things. Cognitive dysfunction is a big one. People can be cognitively brain foggy, where they're not thinking clearly. They have troubles with memory or word recall. Joint pain is another big one. Joint pain in different areas of the body, multiple joints that are affected at once, skin rashes or skin issues, skin irritation and lesions, a lot of digestive issues. can be autoimmune driven. Things like ulcerative colitis or Crohn's disease, if people have heard of those. Irritable bowel diseases have an autoimmune potential. Hair loss is another one. Alopecia, if people have ever heard of that word before, where you can get like a bald spot, either like on the side of your head or like in your beard or something. Temperature sensitivity is another big one. Certain reactions to foods. And symptoms of autoimmunity can what we call flare, quote unquote, where the symptoms could be worse at certain times. You could be triggered by something, and then the symptoms are heightened, and then it kind of calms down after a while. So these are kind of what we see from a whole body system perspective on the way the body reacts to autoimmunity, most commonly.
All right. I did not know that alopecia was autoimmune.
Mm-hmm.
That is really
Can be.
interesting.
Not always, but has an autoimmune sort of potential predisposition. I actually just saw a patient last week with new alopecia.
Oh, interesting.
Mm-hmm.
And this is kind of a sidetrack, but in my mind, and I know obviously, like I don't with very limited knowledge, what about vitiligo?
Vitiligo is also can be classified, autoimmune.
Interesting. Wow.
Vitiligo is, for those listening, vitiligo is where you have complete absence of the melanin in the skin. So it's very easy to see on, say, someone with a darker complexion, where there's like totally absent patches of their skin color, and it's just totally white. So there's a very famous, you probably know, she's a very famous model. What's her name? Winnie Harlow. Winnie Harlow. She has alopecia. Not alopecia, she has vitiligo. But she's like, her skin is gorgeous. Like it's just, and
Yeah.
it's really symmetrical in certain places. It's really beautiful. And I think she really embraces it, but it's very distinct because she has a very dark complexion.
Yeah.
Yeah.
Oh,
Yeah.
interesting. Okay.
Yeah.
So let's go into how does functional medicine, or why does functional medicine treat autoimmune symptoms as clues instead of isolated problems? We kind of went into this, but
Yeah. I mean, the functional medicine approach to autoimmunity really is trying to understand where the problem is going wrong. So autoimmune disease or immune dysfunction can often stem in the gut. It can be driven by some sort of immune dysregulation, inflammatory issues. Stress response is a big one. There's a lot of evidence that is coming out about, especially in women, how trauma and chronic stress can drive autoimmunity. So, especially things like thyroid disease, lupus. Autoimmunity is much more common in women. There's maybe a genetic factor there, but there is this thought that trauma, whether it's like physical, sexual, emotional trauma, chronic stress, can just totally dysregulate your immune system, and then your body just starts attacking itself. So that's a huge issue. So the goal in functional medicine is to understand the pattern and not just suppress the symptom or treat the symptoms. I mean, that's a part of it. It might be necessary, but it's really trying to understand where is the immune system dysfunction going wrong. There are some genetic components, but there are ways to understand this a little bit better from a whole systems perspective on where this is coming from.
well, so that kind of leads us to why is it so important to recognize autoimmune patterns earlier rather than later?
Yeah, I think it's important to recognize autoimmune patterns as early as possible, just like anything else, right? Would you want to have your cancer recognized early or late, right? So it sort of, it kind of goes together, but many patients will live with symptoms for many, many years without getting clear answers because, again, if there's autoimmunity that's crossing multiple body systems, right? If it's GI stuff or skin stuff or fatigue or hair, you might be sent to each of those individual specialists to look at that individual symptom rather than taking a step back to say, oh, this is a whole body problem and not an isolated issue. So recognizing patterns early can help patients understand what's happening essentially. And then it can reduce potentially avoidable triggers and support better long-term management and also better understanding of how to treat, really.
All right. So
So,
let's kind of lead into why autoimmunity is not just a diagnosis conversation, but it's more of a quality of life conversation.
Yeah, I think this is an important question, because autoimmunity is not just about the diagnosis, but the quality of life is important because autoimmune symptoms often affect people's energy. It can affect their work, their ability to work, their physical stamina, their motivation. If you're too tired to get out of bed and go to work every day, that's going to be trouble, right? Can affect relationships. It can affect your ability to actually move around in your own body. If you're in too much pain, if there's some debilitation there, it can affect your digestion. People with really, really significant GI autoimmune conditions could be in the bathroom 20 times a day or overnight, up all night, going to the bathroom, irritable bowel diseases. So your sleep is going to be altered, nutritional deficiencies. So there really can be, depending on severity, a pretty significant impact on daily function. So supporting autoimmune patients really means looking at how the condition is affecting the whole person and not just trying to manage symptoms. I mean, the symptom management is really important, but it's trying to also understand what the longevity of this situation is, right? How does this patient need support? How are they going to be able to live their life if it's debilitating to a point of really bad dysfunction? So,
And why does personalized care matter as much with autoimmune disease? As you say, that autoimmune is a lot longer, like it's multi-systemic, and
yeah,
everyone has different, reactions.
yeah,
So maybe
like
there's
everything we do, personalized care matters so much with autoimmune disease because I think I've said this before on the podcast. Two people can have the same exact diagnosis, but they have completely different bodies. They have different triggers. They have different lab patterns. They have different immune activity. They have different gut issues. Their stress is different. Like I said a few minutes ago, is there a trauma that maybe led to this? What are their nutritional needs, sleep patterns? Genetics, um, not genetics, sorry. Generic plans can really miss certain things for people because it's not that it's bad, but in the conventional medical space, autoimmunity is often treated very generically with biological drugs or drugs that suppress the immune system. And again, I'm not saying that that's wrong. I'm not poo-pooing the medical establishment in that way, but there is often other things that need to be done to address, like we said, function, nutrition, health of the gut, health of the mind. So there's a lot more to it than just turning off the patient's immune system, I think, anyway.
Okay, so symptom-wise, root cause-wise,
Mm-hmm.
I'm kind of gonna combine two questions here because I want to know what the most common root causes or triggers you look for in autoimmune patterns are. But
Yeah.
then our first question is what symptoms should make somebody think maybe it's autoimmune? But I want to know what the most common ones you see are first.
Yeah. So the most common root causes or triggers you look for in autoimmune patients or like patterns of autoimmunity really are, like I said before, we've got to look at genetics, we've got to look at gut dysfunction, looking at issues of inflammation or infection, stress and trauma. I'll probably say that 50 times during this podcast. Nutritional deficiencies, toxin exposure is a big one, whether the patient's had some sort of chemical or toxin or mold exposure, some sort of hormone shift, and then some maybe potential environmental trigger, which could also be like a toxin or a mold. But when we're actually looking at the symptoms, the symptoms that should make people think that this is maybe autoimmune related are when they cross boundaries, right? Multiple body systems, fatigue, right? That's a whole person system problem. Brain fog can be a whole body problem. Joint pain, especially joint pain that's symmetrical, meaning like in the same joint on both sides, swelling in certain places in the extremities, digestive issues, skin rashes that won't go away. Mouth sores is a big one too of a potential autoimmune issue. Not always, but sometimes. Specific hair loss, whether it's circumferential, meaning it's like totally, lost in like a perfect circular pattern, versus maybe just thinning of hair. Um, some other things, dryness in your mucous membranes, like your mouth or your eyes are very dry. Low grade fevers is a big one. So like I've had not a lot, but in the past, I would say 6 months, I've had a handful of women with debilitating fatigue, debilitating, low grade fevers, and just total pain all over the place. And their labs are like totally normal. It's like something's wrong, something's not right. So the fever especially is a sign that the immune system is just kind of cranking, right? When you get sick and you get a fever, that is your body responding to that infection. So if there's fever consistently all the time and you're not sick, that's something is going on with the immune system. So those are the most common things we see.
Okay. And what about
Again, it's not exhaustive, but that's the common stuff.
some of the ones that are less common that maybe we brush off? I know we kind of went, oh yeah,
Um,
we explain away, but
hmm. Some of the most, some of the, well, it depends on the condition. So it could be things like changes in your heart rate. It could be, swelling, like lymph node swelling. But is that more common or not? I'm not sure. Um, I don't know. I don't know of other things that are not as common. I hit a lot of them.
yeah.
I don't know. That's a tough question because we
Sorry.
talked about, most of them. No, it's totally fine. Most of the ones we talked about are across the board, the things we're seeing. So maybe there's little nuancy things. Like I said, maybe it could be a change in your heart rate. It could be a rash of some kind that looks a certain way. It could be dry skin, but that can be common. So really the point is taking a step back and looking at all of this together and not just, oh, you have dry skin in this area, so let's worry about that. It's like, no, there's a whole bigger other picture going on here.
And so how about genetics? Genetics and
Mm.
environment. You kind of talked about mold and that can be a big issue, or that can trigger like an autoimmune
Mm-hmm.
disease. But like
Essentially.
example, I have Raynaud's,
Mm-hmm.
whatever it is, right? Where
Not
you just
related.
not related, where you just
Not
lose
related to me.
blood in your
Yeah.
fingertips, but I got it from my mom,
Mm-hmm.
right? So that's really the only way it affects me. But
Yeah.
that's all I know about like the genetic ones.
Yeah, genetics and environment kind of work together with autoimmunity because genetics could maybe potentially create a susceptibility, but the environment and the lifestyle can influence whether that susceptibility actually comes to fruition. Um, Things like chronic stress, like I mentioned, the trauma, infections, toxins, or mold exposure, poor diet, poor sleep, gut health issues. That's a big one. A lot of autoimmunity has been linked to the gut, and chronic inflammation from whatever that is from, whether it's metabolic dysfunction, obesity. All these things can affect immune balance. So if you're teetering that balance enough, and there's a genetic preceptibility, you might kind of go overboard very easily. And we actually test for autoimmune susceptibility at MedMatrix as part of our initial patient panel, amongst other like autoimmune or not autoimmune, other inflammatory markers. So we can kind of get a sense of this from the first day with new patients. But there is a lot of different things to consider: lifestyle, diet, in terms of the actual fruition of the genetic susceptibility. So
Okay. Um,
I hope that answered your question.
does. So I just have to watch my lifestyle and keep the
uh,
blood leaving my fingers.
yes, yeah.
Okay. Um, so let's go deeper into gut health. Why does gut
Okay.
health come up so often in autoimmune conversation?
There have been tons of books and papers, research articles, basically saying the gut is totally linked to your autoimmunity because the gut is very closely connected to the immune system, and the gut actually has its own immune system. So if there are gut issues like inflammation, dysbiosis, also known as imbalance of the gut, the bacterial like garden, the microflora that you have in there, if that's all imbalanced, if there's digestion issues, if there's food reactivity causing inflammation. A side note of that, one of the most common leading causes of Hashimoto's or autoimmune hypothyroid is gluten. And I think we did a whole podcast on this, actually. I don't remember. Yes, we did. Food issues are big. And then just like I said, general inflammation can influence the way the immune system basically signals in the gut and how reactive the immune system is essentially from that signal. So the gut plays a huge role. And this is very widely understood. This is not sort of, some sort of functional medicine mantra. I mean, this is very, very much heavily researched in the medical literature about how the actual physiology of this breaks down. And with so many people living on the standard American diet, right, their gut health is not good. So the propensity of autoimmunity is just getting higher essentially as time goes on. So that's probably a big part of it.
Okay. And what about inflammation? How can inflammation connect symptoms that seem unrelated?
Yeah, inflammation can sort of connect symptoms that seem unrelated because inflammation affects every part of the body. Anything that hurts, anything that's in pain, anything that's swollen or red or feels outside the norm is inflamed. Inflammation affects your joints, your muscles. It affects your brain, which can lead to brain fog and cognitive dysfunction. Inflammation significantly impacts your digestion and your skin, your metabolism. So a patient may feel symptoms in different places or different body systems, but the inflammation is what could be the common thread there. So it's understanding inflammation, it's understanding inflammatory markers. Another thing we do as part of our new patient panel in the clinic, all really important to get a baseline of really what we're dealing with, because inflammation is really where the problem starts to progress, is the chronic inflammation issue. Yeah.
Mhm. And you were talking a lot about stress and poor sleep. So my question is, how does that affect immune function? You said it's got everything. It's everything to do with it.
It's
So
everything. Yeah. It's one of the tenets of like the foundational issues. Like if you don't sleep, we got to fix that. So stress and poor sleep can significantly impact your immune function because chronic stress and poor sleep can affect things like cortisol, which is one of your major stress hormones. It can affect inflammation. It can affect your blood sugar. It can also affect how sensitive you become to pain, and then how you recover, and also what your immune system signals are doing. So when the body is constantly under stress, the immune system will often be much harder to regulate. So low stress, sort of a homeostasis of the body, allows the immune system to function very appropriately. When that's not the case, it can almost be permanently altered, right? When I talk about that's where this whole issue with trauma comes in, is when the body is traumatized physically, mentally, sexually, if it's mental, emotional, whatever it is, the body holds on to that trauma, and you live in this constant sort of fight or flight stage where you're kind of like trying to attack a bear all the time, and your immune system will always be activated. So if you activate something too much over a long period of time, it can start to backfire and turn on you, essentially, that's where the autoimmune piece can come in. So many people are, especially in America, we live in this high stress, high performance kind of way of doing things. So it leads to chronic dysfunction of our immune systems. Just happens.
So, what does a flare actually feel like? An autoimmune flare? What would it feel like for a patient?
Yeah. So an autoimmune flare can feel like something that the patient is already dealing with, but at a much higher level. So essentially, things like joint pain or fatigue or swelling or skin issues, gut symptoms, brain fog, headaches. If there's a flare, say, for example, the patient has a food sensitivity, and which triggers some sort of autoimmune type issue, or a food sensitivity that triggers gut inflammation, which then triggers an autoimmune issue. The flare can seem like an over-exacerbation of what's already there. So patients with autoimmune conditions often live with a certain baseline level of something, a percentage of pain, a percentage of fatigue. When the flare comes, you might go from 25% to say 75% in intensity. And the flare may last a day, it may last months, depends on what is going on. And the other thing that's important too, from sort of the functional medicine perspective, is understanding the patient's environment. So is something in their environment flaring them, right? Is there some sort of toxin or mold issue that could be flaring and consistently putting that response into overdrive? So that's where we have to go deeper into some of these conversations to understand really what is what's going on, how it presents. All that is really important.
Yeah. And I guess that kind of leads into why do patients have, even though they have these symptoms, why do they have not a clear diagnosis for an autoimmune disease yet?
Patients can have symptoms but not necessarily get a clear diagnosis of an autoimmune condition because autoimmune patterns can often develop gradually over time. And the symptoms may appear before the diagnosis is actually confirmed. And this could be due to access, right? A patient doesn't have the ability to see a provider that can make an appropriate diagnosis. So the goal is not necessarily labeling, but in all honesty, the labeling of the diagnosis can be very freeing for people to sort of say, I'm not crazy. This is a real thing. Because a lot of patients with suspected or potential autoimmune driven issues are often, in my experience, they can be gaslit by the medical community where they're sort of dismissed. Women will be told, well, you're stressed, you're in pain, you're depressed. Here's an antidepressant. Here's some anti-anxiety medication. So the big thing is to understand the symptoms seriously and evaluate the big picture. And that's really what we're trying to do with our patients.
So, we work in functional medicine, but how does conventional care often miss the early autoimmune patterns? You kind of
Yeah,
went into
we
this, but
we talked about this a little bit, but I think it's important to sort of address the conventional approach. And again, my caveat to all of our listeners on the podcast is we are not poo-pooing the conventional medical system and our conventional medical colleagues, but we do feel that sometimes the system just isn't serving patient populations well. So conventional care can often miss early autoimmune patterns because there could be limited testing. Like I said, sometimes if the patient is not able to access care, if the patient's primary doctor is not looking at the whole picture or trying to send the patient off to specialists of the corresponding symptoms, right? Oh, I have this rash. Oh, I have this. Oh, I have this gut issue. Okay, well, I'm going to send you to the dermatologist. I'm going to send you to the GI doctor. I'm going to send you to a pain specialist. And it's like, well, that might not help because those are all three different things that could be basically one thing. So there could be limited testing. There could be labs that come back normal that are sort of brushed off as, oh, you don't have an autoimmune condition because XYZ labs are normal. That happens a lot. And then patients the conventional medical approach is not often looking at triggers, gut health, nutrition, stress, trauma, environmental exposures. So that can be a downfall too. A lot of times, like I said, even if patients are being evaluated by an autoimmune specialist or immunologist or rheumatologist, sometimes the answer is just biologic drugs, which basically are the drugs that suppress the immune system so it won't be as overactive. And again, I'm not saying that's bad, not disagreeing, but is that really a long-term answer? Sometimes it is, and sometimes this is where the beauty of the conventional approach and the functional medicine approach can come together, where patients do need some level of really hardcore medication because their symptoms are so bad. And then once that is on board, us as the functional medicine arm can do work to try to better improve flares, try to better improve inflammation and other nutritional things and gut health. So we can do this together, but it's just recognizing the steps that are needed to do that.
Yeah. So when we go into functional medicine, when we talk about functional medicine, what labs or markers are helping you look deeper when autoimmunity is suspected?
Yeah. So labs that help us understand autoimmunity are all different types of things that can point to some sort of dysfunction in the immune system. So we're looking at full thyroid panels, which include thyroid antibodies. Again, is there just hypothyroidism or low functioning thyroid, or it is an autoimmune? Patterns in your complete blood count. So patterns of the white blood cells, the red blood cells. Vitamin D is a big one. So vitamin D is one of the building block molecules for immune system function. So you need vitamin D, and there's been studies done that chronically low vitamin D levels are linked to autoimmune disease. B12 is another one. Iron is another one, iron and ferritin. So all your iron markers can really impact autoimmunity and the immune system function. Blood sugar markers to understand metabolic health. Gut-related testing, if appropriate. I do a lot of gut testing with my patients to understand imbalance patterns and immune system dysfunction in the gut. Screening for infection, right? Does the patient have some sort of underlying viral issue, tick-borne infection that we need to understand? So these are all things that we evaluate. We don't do specialty testing right at the get-go for patients as they become a new patient. We're doing a lot of these other things, but as we do the baseline panel of inflammatory markers, autoimmune markers with patients, we can get a sense of what's going on. And then if we need more, we do have the ability to do more specific testing. So it can sometimes be a lot to really get a clear objective of what we're dealing with.
Yeah. And how do you decide what you're going to address first in an autoimmune patient?
Deciding what to address first in an autoimmune patient, I think really goes back to how I would address any other patient with any other problem. It really can depend on the patient's symptoms, severity. Do I need them to see a rheumatologist, right, to get a better understanding of things? But a lot of times we just need to start from the ground up, foundational support, right? If they're not sleeping, if the vitamin D is low, if their B12 and iron are low, if like I just saw a patient last week or 2 weeks ago with chronic fatigue syndrome and autoimmune type issues, and vitamin D, B12, iron, magnesium, all were low. It's like, okay, and sleep is poor and nutrition was poor. So no matter the condition, my approach is pretty similar across the board, because these foundational supportive things are really the backbone of the body. And when they're not there, we've said this on the podcast so many times, if you're not eating well, if you're not sleeping, there's not a lot we can do until we fix those things. So we really need to understand those things, but also understanding the autoimmunity potential specifically is important, right? Are there certain medications we can use to help bring down the flare? If the patient is in a flare, are there other types of special tests that we need? So we're really looking at what are our short-term goals, right? Is this patient in an acute situation where I need to act now and we need to try to get them back to work or back to their daily life? And then our long-term goals, our nutrition, our gut health, all that. So it's really breaking down what our goals are. That's my approach. But that's my approach to really any patient with anything.
Yeah.
Yeah.
And what foundations matter the most when somebody is trying to calm their immune dysfunction?
Yeah, like I said, the foundations that matter the most when you're trying to improve your immune system are sleep, nutrition, how much protein are you getting? What kind of foods are you eating? Are you drinking soda all day? Do you even drink water, kind of thing? Are you pre-diabetic? Is there some sort of insulin resistance? What's gut health look like, right? Is there some sort of chronic gut issue? Is there actual irritable bowel disease or autoimmune conditions of the gut that have already been diagnosed? What is your stress like? We talk a lot about that. I do, and I know the other clinicians in the practice do as well. We talk about your life. Are you married? Do you have kids? What do you do for work? Like, are you burning the candle at both ends? So that's a big thing we talk about. We talk about movement. Are you exercising? Are you walking? Are you doing yoga? Are you resistance training? Are you sitting on your butt all day doing nothing? That's a really important part of it. And then, like I said, nutritional status. Are you severely deficient in really foundational things? Have you been exposed to toxins? Do you have mold in your house? Right? So there's a lot of things that we're trying to unravel, when trying to understand how to calm this all down. And this kind of leads us into our short and long-term goal setting. That's where that all kind of comes from.
All right. So let's go specifically into med matrix. And when somebody
Okay.
comes to med matrix with an autoimmune symptom or
Yeah.
diagnosis, where does that process begin?
So the process of a new patient coming into med matrix really is a discovery call, where the patient is getting on the phone with one of our very talented patient care coordinators and starting to unravel the story. Tell us what's going on. Educate us about you. And then that will lead to a really comprehensive health assessment, symptom timeline. Patients will then go into grave detail about their diagnostic history, filling out forms for us to understand all the different conditions you've had, your surgeries, your hospitalizations, all that stuff. When you meet with a provider, you will go through all of that, all your medical history. Tell me everything that's happened to you. We go through your medication and supplement review. We talk about your nutrition. What are you eating every day? Not just, yeah, I eat well. No. What do you eat? Tell me what you eat for breakfast. Tell me what you ate yesterday. How much soda do you drink? Do you smoke? Do you drink alcohol? What's your job? Are you stressed? Are you sleeping? Are you getting good sleep? Tell me about your gut health. My colleague, Dr. Rose, she loves to talk about this on the podcast, but are you pooping? Are you pooping every day? Right? What do they look like? Are they solid? Are they not? Environmental review. So this could be, where do you live? Have you ever been exposed to mold? What kind of work environments have you worked in? Patients that work in, a lot of like public sector jobs, like in public school system or police barracks or other types of like chemical or plastics factories, where there's chemical exposure. Talking, about all these lifestyle factors. So these are all things that we are diving into. And how really the process gets started. We're doing all this information from the very beginning and then coming up with a plan. So it's a lot of information that patients are giving us and that we're talking about before we even come up with any sort of plan.
Okay. And then what are signs that an autoimmune support plan is actually helping?
Ooh, that's a good question. So some of the signs that an autoimmune support plan is helping can really be the flares. We talked about those flares, where patients are having less flares or they feel more regulated. Like, I don't want to say the word normal because I don't like that word, but they feel more functional day to day. My energy is a little better. I'm sleeping better. My brain is kind of turning on a little bit. I'm not as foggy brained. I can kind of do the work I need to do. I can take care of the kids. I can do whatever I need to do at work. Their digestion might be a little bit better. Their joint pain or stiffness might be better. Sleep might be better. Skin breakouts is another big thing. So it's like, yeah, I might have some breakouts, but they're not as frequent or they're not as severe. People's recovery becomes better, and recovery is not just like I exercise and I need time to like recover from that because I did something strenuous, but recovery can be from an autoimmune perspective. If I have a flare and I feel bad, I feel worse, it took me less time to get over it. Whereas it might have taken me a week to get over it, only took me a day. Oh, okay, that's improvement, right? It's not perfect, but it's still improvement. And then also looking at improved lab trends, reduction in inflammatory markers, improvement in nutritional markers. And what we're really also looking for too is when patients are struggling with autoimmune conditions, there's this sort of functional lack of resilience where they feel so yucky. The pain, the fatigue, it's debilitating. People are bedbound or they're homebound. They're not going to work. They're not doing what they need to do. So there can be this improvement in overall resilience where it's like, I am able to go out more. I'm able to do my daily routine. I'm able to get my chores done. All of that is what we call functional assessment, not functional medicine, but assessing your function. How are you functioning day to day? So all of those things are ways that we can understand if a support plan is working. And it might be quick, it might be slower, depends on the patient, depends on what we're treating. So that's a broadest overview as I can give, I think.
Okay. And I mean, it sounds like a pretty good deal versus not having a plan at all, right? And I'm sure a lot of patients
Yeah.
have no plan at
Yeah.
all.
Yeah. I think, and that's a good point actually, Leah, that you brought this up. So I try to educate patients a lot, especially, so if we look at autoimmune disease as like a complex chronic illness, which it essentially is, complex chronic illness is not something that's treated overnight. So it might not get better in 2 weeks. It might not get better in a month, so the thing with these types of conditions is, which is really important from my perspective, is educating on the expectations. So if I can sit a patient down and say, hey, these are our expectations of care. This is what we're looking for at the first week, the first 3 weeks, the first 6 weeks, the first 3 months. People can get a better sense of what that means, because oftentimes, and again, no disrespect to the conventional medical model, but most of my patients that have suffered with some level of complex chronic illness or autoimmune issue, they get upset with their doctors because there's not a clear outline. It's just, I'm sorry, I don't feel good. Here, try this medication. Okay, but like, what are my expectations? Am I going to feel better tomorrow? Is this going to be a year? Patients often with complex issues like autoimmune have been struggling for some time. So they're not necessarily upset that they have to continue to struggle. They're upset that they don't know what the plan is, or they don't know what the expectation of care is. I'm happy to struggle a little bit through this process if you give me a clear outline of what I'm supposed to expect from this. That, I think, is worth often just as much as the treatment itself to get better, is what am I supposed to expect this to be. And I think that's, to kind of go back to the conventional approach a little bit, I think that's something that is under delivered from a conventional medical perspective in this kind of autoimmune complex illness world. Is what does this all mean? How does this affect me? When can I go back to work? And we don't have all the answers, right? I'm not God. I don't have this sort of crystal ball, but if we can put very specific goals in place, every couple of months or every couple of weeks or whatever, it gives a lot of sense of hope. I know that's kind of cheesy, but it's true. So,
I mean, I don't think that's cheesy at all when you're
yeah,
chasing hope and you really can't find any. I think
yeah, yeah. You're right.
it's very human.
Yeah, you're right.
So, what is the biggest takeaway for somebody who suspects that their symptoms might be autoimmune related? What's their biggest takeaway from this discussion?
Yeah. So the biggest takeaway for someone who suspects their symptoms may be autoimmune related is not just ignoring clues just because they might seem disconnected or vague, or if you've been told by a healthcare provider or someone that's evaluated you, this isn't a big deal, right? Being often patients with symptoms like these autoimmune or complex illness issues, they often are very intuitive because they may have been struggling with these issues for a long time. So their intuition is extra heightened from, say, someone that doesn't struggle with chronic health issues. So listening to that person give me their sense of self is really important for me, because it really gives me a sense of what I'm dealing with. Autoimmune symptoms can show up across the entire body, and they really deserve that whole person approach. Like I said, if you have symptoms of something that's across multiple body organs or body systems, and you're being sent by your primary care doctor to 3 or 4 different specialists to evaluate each of those little things, you may be losing missing the mark. And unfortunately, in the modern healthcare system right now, it could take you many months to see all those specialists. So it's even longer of a time that you're getting no answers. The functional medicine approach really helps connect the dots. It identifies the triggers we talked about. It supports immune system balance and function. And then it's building a really personalized plan for, as I said, what are our short-term goals? What are our long-term goals? And what are our expectations on quality of life and vitality? Am I going to be 100% better? Am I going to be 50% better? All those things really come into play there. So that's my biggest takeaway, is listen to yourself and continue to ask questions. If you're not getting answers, then ask them 50 more times to 50 more people, because you know your body better than anybody, essentially. Oh, bless you.
I thought I muted myself, but I guess I didn't.
You did, but I can see that you're sneezing. For those listening on the podcast, they won't be able to see you, but that's okay.
Sparing everyone the auditory.
It's all about good podcasts are not so buttoned up, right? Yeah. I like podcasts that are not so buttoned up,
I just don't think that personally I'm ready for my sneeze to be out there. I think it's more of a personal thing.
Okay.
All right. Good. Well, thanks, Colin. That was incredible. I think, do you want to go straight into Q&A?
Yeah, there's some questions in here. We can, yeah.
Awesome. So this question is even into arthritis in the joints, and I assume that's like how autoimmune manifest.
Yeah. So there are autoimmune conditions that affect the joints. So arthritis might not just be arthritis; it could be an immune-driven issue, and often arthritis is not necessarily just quote unquote wear and tear that they say. It's some sort of inflammatory issue. So pain, stiffness, swelling is all inflammation. So there are some very specific patterns, though, the way that autoimmunity can present itself in the joints. So yes.
Okay. And what about constant urination?
For an autoimmune condition, I don't know. I saw this question earlier and I was trying to think about this. So there are different types of autoimmune related, what we call diabetes insipidus, which can affect, constant urination, interstitial cystitis, or inflammation of the bladder, is linked to immune system responses, which can cause a lot of pressure, pain, and frequent urges to go to the bathroom. There's lupus nephritis. So the autoimmune condition lupus can affect the kidneys, which could cause an increase in urination. There's I'm trying to think if there's, I was trying to think about this as we were going through the podcast from this question. I can't think of other things, but some of these problems can cause bladder inflammation, kidney stress, and hormonal imbalance that could lead to more constant urination. So this is maybe a perfect example because this is from the same person. It looks like Lori Ann. Hi, Lori Ann. Is asking these questions. So if there's maybe joint issues and constant urination complaints, maybe, this might be an autoimmune condition. So again, poke at your doctor to help.
And which tests are autoimmune markers?
So there's a lot. So it depends on the disease. Like for example, like rheumatoid arthritis or, some other autoimmune condition that are rheumatoid arthritis or lupus, or there's all different things. So autoimmune markers are blood tests that we use to detect the immune system's activity against its own body tissues, basically the definition of autoimmunity. So some of the primary things we're looking at is an ANA, also known as an anti-nuclear antibody, rheumatoid factor, RF. There's also C-reactive protein, which is a inflammatory marker. These markers can help us identify when the body is essentially attacking itself, but those are more general screening markers. They may not be specific to a disease necessarily. So there are specific what we call autoantibodies, which are disease specific. So like rheumatoid factor can be high in people that have rheumatoid arthritis. There's something called anti-CCP, which is specific to rheumatoid arthritis. There's also something called ANCA, or anti-neutrophil cytoplasmic antibodies, which are present in types of what we call vasculitis or blood vessel inflammation. And then the most common ones that people are sometimes used to is the thyroid antibodies, thyroglobulin antibody and TPO antibodies, which are specific markers used to identify autoimmune conditions like Hashimoto's, like we talked about earlier. So there's the general, there's the specific, there's a lot. And we do some of these markers with patients on their initial blood draw at MedMatrix when they join the practice for their initial evaluation.
Okay. That is a lot of tests.
Sorry if that was long-winded.
I mean, you prepped us.
Yeah, sorry.
All right. And why is it that people usually have more than one autoimmune condition? And how do you treat multiple autoimmune problems in a single patient? That's a good question.
Really good question. Gosh, Leah, why didn't you come up with this? Jeez,
I'm taking notes.
Like, jeez. No, it's a good question. So thank you, who asked this question. So people can have more than one autoimmune condition if there is certain drivers of the body to be more autoimmune-ish, as I say. So like the genetics, right? We talked about this question earlier of it, the genetics really cause the presusceptibility, and then the environment, the nutrition, toxin exposure kind of makes it into fruition. So if there is a chronic exposure to something that is driving the immune system to be wonky in an autoimmune-esque fashion, you could essentially look at that as, your singular immune system in your body, but then it kind of branches off and affects different areas. So this is a perfect example of something there's a genetic presusceptibility, because once you have one autoimmune condition, it's easy to get another one because your body's already in this kind of inflammatory immune response. And treating multiple autoimmune problems in a single patient can kind of go back to what I was talking about before, when we're trying to understand how to get started. So it's really back to the basics. No matter what the autoimmune condition is, we can certainly look at some of the specifics of, say, diet or maybe supplements or herbal things that we might use to help that specific condition. But it really comes back to the basics: diet, sleep, nutrition, stress, trauma. I've had a couple in my career, unfortunately, where women were victims of sexual trauma or rape, and very shortly after that, they got an autoimmune disease, because it's just this trauma on the body just made the immune system go totally haywire. So it really comes back to all those basics, no matter what the problem is, or if they have multiple problems of autoimmunity. It's really satisfying all those foundational issues with understanding how to build the foundation before we put the house on the roof, or the roof on the house. Sorry. All that stuff is really important. So again, sorry if that was long-winded, but I think it was a great question.
All right. Well, Colin, thank you so much for joining us tonight.
Yeah, thank you for having me.
Long day. I really enjoyed this podcast. I learned a lot from it, and
good. I hope everybody else did too.
Hope everyone else did too. Yeah. So if you are, once again, interested in becoming a patient, feel free to visit our website and book a discovery
MedMatrixUSA.com.
MedMatrixUSA.com. Book a discovery call and connect with one of our patient success coordinators and look on getting that list. So thank you so much, and I hope you guys all have a great night, and we'll catch you next time.
Bye, Leah. Thanks.
Bye.